A very good evening to all of our audience for tonight. I am Dr. Surbhi Mitra, a psychiatrist, as well as the moderator of this show brought to you by Evrox Healthcare, which is a digital healthcare company. And its flagship product is the F1 app, which is going to be launched soon, for which we are definitely looking out for doctors, healthcare workers, and as well as other, workers who also specialize in mental health and nutrition. So if you are willing to join us, please do drop us your comments and your names as well as your email IDs so that we can contact you for the demos. Today's topic is related to dermatology, and as we know that a lot of people on this planet have been worried about their skin care, and today we have two good dermatologists amongst us. One of them has been my mentor at my college during MBBS days, Dr. Sushil Pande, who is actually the also the editor of the Indian Journal of Drugs of Dermatology, as well as he has done his fellowship from Germany. Please welcome Dr. Sushil Pande.
Thank you, Surabhi.
Good
Thanks,
evening,
Surabhi.
sir.
Thanks
Very
for
happy
joining.
to have you.
Thank you.
Thank you for accepting my invitation.
Welcome.
We also have one of my seniors, Dr. Puja Dharmik, who did her dermatology while I was in first year of residency at the same college, NKP Salve. Please welcome Dr. Puja Dharmik, who has also done her fellowship in aesthetic dermatology.
Hello, hi Dr. Surbi. Thank you for inviting us.
Hello, Dr.
Hello,
Puja.
good evening, Dr.
Okay.
Sushil Pande, sir. Good evening.
Good evening, Puja.
Okay, so I think the mentor and both of the students are here, and we can finally go ahead with the session. So, beginning with skincare. Basically, skin, as we know, is the largest organ of our body, and it is highly neglected. So, why did you choose dermatology as your subject, and what do you actually have in it? I mean, why is skin so important? So, we'll start with Dr. Pandey.
Yeah, it's a very good introductory question, Surabhi, because dermatology has always been our passion, and this was the less traded area as far as the medical graduates were concerned. And while we were doing our MBBS, I realized that skin is one of the most important and one of the largest organ of our body. And there are not too many specialists who are actually into skin care and in the management of skin diseases. So that is why, out of my passion and interest in the subject of dermatology and skin care, I joined dermatologist branch, and I'm very happy about it. Just not just to treat patients with skin diseases, but also to take care of the skin health of these subjects.
Okay, okay. Thank you, Dr. Pandey. So, Dr. Pooja, why do you think skin is that important to be discussed, as well as why is it that important as a subject?
Yes, Dr. Surbi. So, as you already mentioned, skin is the largest organ of the body, right? So, it covers the entire body, and you'll be surprised, being largest organ, whatever happens inside the internal organs, if there are any disturbances, you can directly reflect on the skin. So, in short, you can say that we are the CID agents, and we can reflect if you have thyroid dysfunctions, or if you have diabetes, or any stress that can be reflected on the skin. So it gives a telltale sign, and that is why skin is always has been my fascinating subject, even when I was doing my MBBS. So that is the most important organ, and it covers our body. So of course, then that is the reason why skin is a very important part of our body.
Okay,
Surabhi, can I
yes.
add into that?
Please, sir, please do.
Actually, skin is one of the very important organ. It's actually protects us from so many environmental hazardous stimuli such as the wind, then the temperature, and also the microorganisms. And apart from its protective nature, it also plays very important role in a temperature regulation of our human body system. And it is actually our presentation of your internal or a physical body to the exterior world, as Pooja has already mentioned. So skin is not only the largest but the most effective organ, not just physically but also it parts of your personality. So from psychological perspective also it is one of very important organs.
So you can say in short, it is the mirror of our body. In short,
Hmm.
skin is a mirror. So whatever reflects inside your body can be reflected on the skin. So we are the first physicians to diagnose the internal disturbances.
Oh, wow, wow, that is wonderful. I mean, I never knew about this, honestly speaking. So, even after studying a little bit of dermatology in MBBS, we know that it's hardly, covered well during MBBS days. Same with psychiatry, like my branch. So, we hardly knew anything about these branches during MBBS. So, now I'm learning from both of you. So, thank you so much. Also, like the most important aspect that is constantly discussed about skin are the acne, and mostly it's like the women, the men, the little boys and the adolescent girls are constantly worried about acne. So what are acne and how can they be prevented?
So you want to take the question?
You can start, no problem.
Okay. So, acne, I mean, there are different types of acne, but we almost in our practice, we see mostly teenagers who are concerned about acne. So, from teens like 15 to 20, 18, that is the age group where acne manifest. And skin has pilosebaceous gland, the sebaceous gland. The activity of the sebaceous gland increases because in teenager, the hormone testosterone increases, which increase the size of these glands and causes increased production of sebaceous fluid, and which causes the blockage of the gland and in turn results into acne, right? So this is mostly a teenage presentation, and the treatment of acne is very simple. You have to have basic cleaning of your face using right cleansers and right acne treatments as prescribed by your board certified dermatologist. But there is a misconception or myth that acne is present only in teens. Acne can be present even after 30s or in 40s, and mostly in females we see that, and that is hormonal acne. And acne can be equally present in both males as well as females. The reason is mostly after it happens 30 years of age, it is hormonal acne. And the treatment is different for hormonal acne, whereas in teens, the treatment of acne is different. So the right approach, diagnosing the acne at right time and treating it properly by a board certified dermatologist is the right approach of acne treatment.
And the
Yeah,
preventive measures.
rightly said, Pooja. As I
Yes sir,
could
please
say, it's not
continue.
a disease, but it's an issue of an adolescence where you have increased hormonal levels, and because of this increased hormonal levels, there is more oil secretion or a sebaceous secretion, as she has already mentioned, and that is what causes the teenage acne. But one important thing I would like to tell to all youngsters that don't consider it as just a teenage acne, because acne is going to go once your adolescent age is over. But if it increases in the size, it will result in a lot of acne scars, and that can cause significant cosmetic disfigurement to your face, and it will leave behind permanent scars, and that will affect the esteem, confidence, and many it will change your personality. So just don't let it go as a teenage event. As Pooja has mentioned, you must visit a qualified dermatologist to take care of this acne. It has several causes. Apart from this, lot of medicines also can induce acne. The stress can also induce acne. The obesity or increase in the weight can also aggravate acne. And nowadays, what we are seeing in the COVID days, that people were using a lot of masks. And when
Hmm.
the season is very humid, they people tend to have a lot of acne. They never had acne earlier, but all of a sudden during COVID pandemic, because of excessive use of the occlusive mask, they were having a lot of acne. And same is also true when you apply a lot of oils or a lot of moisturizers on your face, which actually block the pores and can give rise to acne. So acne has several reasons and several components. And the message is you need to visit a proper qualified dermatologist so that it can be detected early and treated early so that we avoid acne scar and cosmetic disfigurement.
So, what would be the household preventive measures that one can take?
Yeah, that's a very right question because most of these patients they do come to us after they try the household remedies first, and a lot of nuskas and a lot of things that has been there in the household. But it's a issue we need to understand. It is because of the hormones and because of the young age. So most of these household remedies would not work to the satisfaction. Maybe they have some role in preventing acne, but everybody's skin is different and we cannot generalize the household treatment. So my advice to these youngsters is not to try household remedies or the remedies that has been suggested by their friends. We need basically to understand that everybody's skin is different, and therefore, as Pooja has mentioned, you must visit a qualified dermatologist or a specialist. And the treatment is very simple. It doesn't require too much of applications. It just requires some basic medications and basic skin care so that effectively we can tackle the teenage acne in the early stage.
Sudhi, I would
Right.
like to add few points if you
Please
allow
do,
me.
ma'am. Yeah.
So acne, it happens now. It is increasing mostly in teenagers because of new condition called as PCOD. If we all are aware of polycystic ovarian disease, and it has become a pandemic now, right? PCOD, like if I'm seeing 10 patients in my OPD, like out of 10 patients, 6 patients are having PCOD because of their lifestyle, the way teenagers are living, and that is causing hormonal disturbances, and that is the one of the important reasons for acne. And the other thing is Instagram, Facebook, social media. They have a lot of education regarding how to treat acne. They give a lot of house remedies to treat acne, right? And one of the grievous treatment what all my patients, most of the patients do is they will apply toothpaste for acne, right? Or they will apply the one tube which has been prescribed to her friend for the acne treatment. So, as rightly said by Dr. Sushil Pande sir, the even if I give a treatment for a ex patient for acne, that doesn't mean that the same treatment will be copied, control, copy paste to the next patient. So you have to understand each and everybody has different skin, and the treatment protocol for acne will be different for your according to your skin type. How severe is the acne? So in short, one size doesn't fits all. So the acne treatment depends upon the type of your skin and what is the presentation of acne. And I will always give a small advice: don't follow blindly social media, and don't use household remedies without like people apply aloe vera gel, they'll apply toothpaste, and they get severe burns for acne. So for treating acne, there is acne also, and in addition they will get burns due to toothpaste and irritant contact dermatitis.
Right. It's so true because even I know that a lot of my friends used to, just borrow tubes from
Yes.
their other friends.
Absolutely.
हॉस्टल पे
So
लड़कियां हैं
one
और
size
बस
doesn't shoot fits all.
that's
One
true.
shoe
That's true.
size. Yes.
Yeah, so that is a very common practice actually कि मेरे friend को ये prescribe हुआ था या मेरे mom को ये
Yes.
prescribe हुआ था मेरे sister को ये prescribe हुआ था and they just apply the
Yeah, the
same ointment.
neighbors and the neighbor
Yeah,
auntie will say, yeah. So that doesn't apply to each and every individual. People need to understand that every skin type is different, and the treatment depends. The tailored treatment depends upon your skin type, and a
exactly.
right person will be always a
A
board certified
dermatologist.
dermatologist. Yes.
Yes, yes. So now that we also talked about burns, what has been happening is कि typical you can hear कि मैं तो tan हो गई, मैं धूप में निकल के tan हो गई, मेरे को sunburn हो गया है, मेरे को ये हो गया, मेरे को वो हो गया है. So now coming to tanning and sunburns, what is exactly a sunburn, what is exactly tanning, and how do we prevent that?
Okay. Subi, that's actually a medical question. Generally, sunburn is a very exaggerated term used by Indians, as a true
Hmm.
sunburn is very uncommon in country like ours. Sunburn is actually common in Western countries where they have less melanin. When they go out in the sun, the ultraviolet light, particularly the ultraviolet B light, acts on it. It causes damage to your skin cells and a lot of burning and redness. So that is called as a true sunburn. So this kind of true sunburn is very uncommon in country like ours. But all these sunburns is invariably followed by pigmentation, and that is what we call it as tanning. So this is the tanning that most of the people are really worried about. So we get usually the low grade sunburn followed by immediate and a delayed tanning. So as compared to sunburn, tanning in the photo expose area is the pretty much common issue in country like ours.
Right. So
Dr. Sulpi. Okay,
yes, Dr.
go
Puja.
ahead. Go ahead. I'm
No, no,
sorry, you
please,
can go
please go
ahead.
ahead. No, no, please go ahead.
Okay, sir has rightly said that tanning and burns are two different things, and we always get tan. So I would like to add few things about tan.
Yeah,
Tan is a
sunburn is a misused
pro-
terminology. Right.
Yes, tanning is a
Yeah.
protective response. Like if you go out for vacation on high altitudes or beach, it's a protective response of your skin, right? To protect from sun. And tanning is mostly due to more UVA exposure. So, to avoid tanning, if you're going on a vacation or if you are going to visit high altitudes, you have to use a broad spectrum sunscreen which has UVA as well as UVB protection and SPF at least 50. Okay. And an ideal sunscreen has three more things to consider. Like it should have SPF 50 at least. It should have PA factor. PA factor will cover UVA protection, and UVA protection is needed to prevent tanning. And the third is boot star rating. So, whenever you're buying a sunscreen, you should have these three things kept in mind, which will prevent tanning. But tanning will happen to a certain extent, and it will self resolve in few days, like in a weeks. It will resolve. But even if you're concerned about tanning, you should prevent tanning by using sunscreen and using broad trim hats or protective gears like protective full sleeves and reapplying sunscreen after every 4 hours, and a right amount of sunscreen should be used. I tell my patient 10 paisa coin. That is the amount of sunscreen you have to apply on the face. And the sunscreen has to be applied even if you are indoors. That is a myth that people think if you are inside, indoors, you don't have to apply sunscreen. No, you have to, because indirect sunlight comes from the windows. And lastly, even if it is cloudy, people don't apply sunscreen, and that is the reason why they get tanned. So you have to apply sunscreen 365 days in a year. And secondly, if you have tan, it can be treated by dermatologists, but don't treat the tan in active phase. We tend to protect the skin. We give the priming to the skin by very less mild agents, and then microderm abrasions, and there are some peelings like skin lightening peels, which can be done after a week. The tan has been a little bit controlled.
Okay, so
Yeah.
as you said that, yes, sir, please, please, please add on.
Actually, just
Yeah.
want to add that actually it's important that we preventing a tan is more easier than treating a tan.
Yes,
And as
yes.
rightly pointed by Pooja, it will automatically disappear in maximum 3 months of time. Most of the time, patients do come to us that they wanted to go to high altitude or maybe for an honeymoon, and they want complete prevention of tanning, and they are willing to use very high SPF, high UVA protecting creams. But one needs to understand that it is impossible to avoid tan in the
Hmm.
country like ours, because as rightly mentioned by Pooja, it is a protective response.
Protective
So
response, yes.
protective response. So actually tanning is preventing us from harmful ultraviolet rays. So in fact, it's a protective response, but we nobody likes to get tan or pigmented. So one needs to use a very high quality, high SPF sunscreen that you can minimize the tan, but may not completely prevent it.
All right, all right. So now that we talked about tanning, so there are a lot of fairness products and fairness creams running wild in the pharmacies and in the general stores. So what do you have to say on that? What is your take on those fairness creams and fairness products?
Yeah, actually, the fairness industry has boomed like anything in last few years, and people have a lot of craze regarding this fairness cream, or what we call it as depigmenting cream. And it is thanks to a lot of advertisements and branding on the television that people are more conscious about buying this cream to minimize the tan or to decrease the pigmentation. But as we started in this, that everybody's skin is different, and most of these creams are is a cocktail or a combination of so many depigmenting agents derived from the plant sources, or maybe obtained from synthetic sources. So there is no harm in using this thing, but they have a limited role, because there is not just a depigmenting cream. There are so many factors as per person's photo protection levels, then the exposure time in the sun, and then the deficiency of vitamin B12. So a lot of things do play a role in the pigmentation of a facial or a pigmentation of rest of your body skin. So there is a craze for this depigmenting cream, but one must understand that they work only to limited extent, and they need to be applied continuously, and more importantly, they are very expensive creams as well. So people may not actually utilize them fully, may not apply them at a regular intervals, and that gives them very limited effect. So in a situation like this, one needs to approach a dermatologist who had some other procedures also to decrease the pigmentation.
I would
Okay,
like
I
to
think
add
Dr.
on.
Puja would like to add. Yes, yes, please go on.
So, unfortunately, we live in a society where fairness is considered to be a good thing. I mean, that is the bad part, because always
It's a major
whiteness
criteria
or
for defining beauty,
yes, yes. So, if you are
unfortunately.
fair, unfortunately, right? If you're fair, then you're considered to be beautiful. I tell my patient, you have to accept your skin color, the color which you have. The neck color is your original color, right? But then they'll the film industries and everything has they'll ask, like, XYZ actress was not that fair, but after certain glutathione, for example, they will be demanding for glutathione, IV glutathione, which is not a certified treatment. It is not FDA approved treatment, even though people go for glutathione whitening treatments, but it is not very ideal because it is temporary thing, right? So I first tell the patient that you have to accept the color which you have. We can decrease like one or two shades, you can tone down if you have a right regimen. See, only creams are not going to make you white. You need to have a proper sleep cycle, 6 to 7 hours of sleep. You need to have a proper diet, which is very important. Second thing, you need to include good food like colored vegetables and fruits, which has antioxidants, right? So they are going to cause you a little bit of brightness, and vitamin C containing fruits and vegetables, it should be included. So I believe more of a natural thing for treating pigmentation. So if you have these things like a proper sleep, proper food, and if you exercise, after that you have to use a right regimen. Like there are a lot of depigmenting agents, and I always say, like, social media, the fad is everybody will come with vitamin C application, and they think if you apply vitamin C serum you'll get fair, because it is advertised on the social media that use vitamin C serum and your skin will be lightened 2 to 3 tones, shades lighter. But the thing is, vitamin C serum, there are some patients which they come and apply vitamin C serum and then they get irritant contact dermatitis. So they were going for depigmentation, right, for fairness treatment, but they used vitamin C over the counter. They got vitamin C and they got irritation. So I would like to say that it is a comprehensive treatment for reducing your pigmentation, and you can't go like 4 to 5 shades lighter if you use any unnatural methods. So go for natural ways of lightening your skin, and the safest one are kojic acid, and there are niacinamides, but I think they should be applied under the guidance of dermatologist. And lastly, accept your skin color, embrace your skin color.
Surabhi, one just quick point. Uh,
Yes, sir.
Actually, because of the very poor regulation in our country, most of these over-the-counter fairness creams or the ones which are advertisement in the newspaper, they contain harmful chemicals, including potent steroids, and
Yes.
that actually can lighten your skin temporarily, but it will cause a lot of side effects to your skin. So one needs to be very aware about these tall claims and the advertisements there in the print media or in the social media also, and one should actually see whether your topical fairness cream contains corticosteroids. If it contains that, please try to avoid it.
Sir, even hydroquinone also, there are
Yeah.
over-the-counter hydroquinone creams, right? So we also give hydroquinone creams for skin lightening, but then it is under a tailored treatment. Like for a few months we give, and then we bridge it with non-steroid, non-hydroquinone combination. So people have to remember, like if you're buying a fairness cream, you need to know your ingredients, which is very important. Like you need to understand. See, the patients come and they have a very common cream. Is it okay if I mention the cream names?
Yeah, yeah. Please do.
Gori cream. And when I asked the patient to get the medication, it was written in Arabic language, the ingredients.
Okay.
So I said, "Do you know what you are applying for getting fairness?" And in return, she had thin skin. There were acne all over her face, and there was atrophy because steroids over a prolonged period of time, if you apply, it will cause thinning of your skin and redness, rosacea, and she was having a lot of facial hairs and acne due to fairness treatments. And she used those fairness treatments because she thought that is very easily available to her, and that was again told by her friend. So I don't know, unfortunately in our society fairness has been always the center of attraction. So people need to understand fairness treatments should be taken only with the help of a known person, like a certified dermatologist.
Certified dermatologist.
Yes,
Yes.
yes. And steroids should be not used on the face unless a dermatologist prescribes. And it is only for a short period if we prescribe a steroid over the face.
Yeah, so a very important psychological and philosophical message there as well, that you should embrace your color and
Yes,
just be happy if you're dusky. Why not? I mean,
love the
yeah.
skin you are in.
Yeah. Okay. So, now that we also talked about the application of ointments and steroids, so don't you think fungal skin infections have, grown uh, over a period of
Yes.
time? I think they have become more and more common these days. So, how do we go about them then? These skin fungal infections.
Yes, actually, skin infections, particularly the fungal infections, as you mentioned, has become like a pandemic, just like a COVID. And everybody almost in the house, particularly in the rural areas, is suffering from these fungal infections. There are many factors to this, including environmental changes, uses of occlusive clothing, and use of topical corticosteroid creams, particularly in the groin. So there are so many factors attaching to that. And when we use topical corticosteroid creams prescribed by the general practitioners or maybe the quacks or maybe by unqualified dermatologists, so instead of getting the better, your problem gets compounded, and therefore our patient must need to understand that we must visit a dermatologist, and little bit of change in their clothing patterns, then your clothing style, uses of soaps and everything needs to be changed. Better to approach a dermatologist who will actually advise you regarding not just about the treatment, but also about the general care that needs to be taken for the treatment of this fungal infection. And believe me, it's looks to be a very simple problem, but nowadays because of resistance to so many antifungal drugs, the treatment duration is actually increasing, where we need to use the oral medicines and very expensive medicines for a very long period of time, and despite of that the disease might come back after a period of time. And it is not just cases of simple localized fungal infections. Nowadays we are seeing fungal infections which are very widespread, occurring most of our body and not just limited to a single member of the family, but also other family members are getting affected. So it's becoming a big menace in country like ours, and we are moving for the fungal capital of the world in next few years. So it's a very situation is very grim, and unfortunately, people are not trying to understand that they must need to visit a qualified dermatologist so that you can take care of this problem in the initial stages, so that it doesn't become a chronic problem and it will definitely not affect the quality of their life.
All right, all right. Dr. Pooja, I think you would like to add something.
Yes, as rightly said, I don't know why people are shy on visiting dermatologists when they have fungal infection. If they see a single patch, they'll always avoid visiting a dermatologist. And unfortunately, sir, do you agree that we don't get naive patients of fungal infections? We get patients of fungal infections who are treated like for a year by themselves, or they have wrongly applied wrong ointments, right, sir? So
Yes.
very naive patients we generally don't see. So that is the reason why we are getting a lot of fungal resistance. So Surbi, what is the reason behind that is, there is a one oval patch and they think it is a fungal infection or whatever. One red patch on your skin, trust me,
Yeah,
it
I
can
think
have
they
20
automatically
different,
think that it's ringworm.
yeah,
Like
ringworm,
in
and then
general, they
they'll
just talk
apply.
about it as though it
Yes,
is ringworm.
yes, but that one oval patch can have more than 20 diagnoses, right? Even if it is a fungal infection for, say, like a simple ringworm infection, and they apply steroid. So what happens if you apply steroid initially? They'll be very happy because the inflammation reduces. But by doing this, what is happening is the infection goes deep inside the skin. It becomes incognito, right? And then it is very difficult to treat, and that is the reason why we are facing resistance. And people are not responding to the which was the basic treatment for the fungal infection. Now we have to use higher doses of itraconazole and other higher antifungal drugs. And the other reason is there is a ping pong phenomena in पिंग पोंग बॉल जो रहता है ना, यहाँ से वहां से यहाँ
Table
इन्फेक्शन.
tennis,
So
yeah.
yes, that is happening due to not taking considering fungal infection as a very serious concern. So if you see a oval patch, one or two, don't ignore it. Don't be shy on visiting a dermatologist, because the treatment will be very easy and it will be of only few months, like couple of months, rather than if you are visiting after 2 to 3 years. The treatment is going to be long term and it will take more time and it will be more expensive if you consider money wise. And lastly, patient needs to understand fungal infections. They need to take particular precautions, right, for getting the fungal infections treated. First is right amount of ointments has to be used. Avoid steroids for fungal treatments.
Yeah, I
Lastly,
remember
the
in between there was an era of this cream or this ointment called as Betnovit. If you remember,
yes, yes,
everybody
yes.
used to use Betnovit just like that.
So
And it had
Betnovit
a
is
lot of
the
steroid in it.
only cream which dermatologists prescribe. Everybody is like, dermatologist के पास जाओगे तो क्या Betnovit ही जाएंगे? So it's better you go to a pharmacy and buy a Betnovit cream, because it
Betnovit
will save
cream, yeah.
money, right? Going to a
Yeah, the
dermatologist is
consultation
going to
fees,
charge you
you always
bomb.
want to save the consultation fees.
Yes, penny wise, pound
So
foolish.
earlier there was only Betnovit cream. Now there must be thousand brands of similar preparations, which has actually produced havoc in a country like ours. And these steroids actually take care of itching for a very short period of time. So people feel that it is giving you a relief, so they keep on applying,
Yes.
and
Yes,
ultimately they'll
yes.
end up with the side effects. So that's a very important message one must bring from this discussion. Never ever use the so-called steroid or combination creams, and use a very specific medications, and always visit a dermatologist. Never shy to visit a dermatologist, because if your problem is solved a little early, it's better. Otherwise it will definitely become a chronic problem, and it will affect the quality of your life.
Yes, yes. Now that we also talked about, fairness treatments and beautification methods, so I think we also need to discuss about hair and hair fall treatments. So what happens generally is that baal hai to jahan hai wali baat ho jati hai. Otherwise, if you have less hair, then again you have a loss at your, some sort of a, imagined loss at your beauty. So what do you have to say about that?
Who
Dr.
wants to
Puja.
take the question first? Okay.
Yeah, Dr. Puja, please go ahead.
Okay. So first thing, hair fall. Falling of 100 to 150 hair per day is normal. That is the first thing everybody needs to understand. Okay. And if you are having more than 150 hair fall, then it is considered to be a serious condition. So the hair fall can be due to a lot of reason, and one of the important now leading reason for hair fall is COVID. So any sort of infection, maybe COVID, dengue, malaria, dengue after pregnancy, these are the most of the important causes for hair fall. Even there can be
Oh yes,
nutritional
Dr.
causes
Puja, I need to
like,
consult you for that. I'm losing a lot of hair during this COVID. So
yes.
yeah, we'll talk about this after the seminar.
Yes. And then there are nutritional causes like vitamin B12, vitamin D, biotin deficiency, protein deficiency. Stress is one of the leading cause for everything, if you count on. And understanding the process. See, COVID hair fall doesn't manifest immediately. Or after dengue or malaria, the hair fall manifests after 2 to 3 months, and the hair fall persists for 6 to 7 months, and it is completely reversible. You need to understand the hair fall is going to be completely reversible if you take proper biotin supplements, protein supplements, and if there are underlying deficiencies which people are not aware of, like vitamin D is one of the leading cause for hair fall. And half of 90% of the population are nowadays vitamin D deficient. Even there are certain hormonal causes for hair fall, like thyroid problem or say it diabetes. These are few of the conditions which can cause hair fall. There are certain drugs, if you are on certain medications like anti-TB drugs or on antidepressants, they can also cause hair fall. So, first and foremost, you should know the reason why you have hair fall. It is not just apply onion oil and your hair fall will be completely reversible. That is not going to treat your hair fall. We need to understand what is the root cause for hair fall, understand the cause, treat the underlying cause, and once you are on treatment on your hair fall treatment, understand the line time frame. It is not going to be instant. We don't have magic wand to treat your hair fall in like 15 days. You eat medications and hair fall will be completely treated. It takes 3 to 6 months for your hair fall to be arrested. And even after that, the hair fall is not arrested. There are a lot of advanced treatment we as a dermatologist have in our clinic. One of the upcoming and the booming treatment, which all of us know, is platelet-rich plasma or stem cell, or there are a lot of fancy names like super PRP or thing. But this is not the only thing which is going to treat your hair fall, right? It is a cocktail, like a mocktail. You say the interesting ingredients you add in your mocktail, the mocktail will be tasty. So if you add like biotin supplements, or you treat the underlying causes, B12, vitamin D, iron deficiency, and with PRP and other mesotherapies, hair fall can be treated. So first, find the cause for hair fall, treat the underlying hair fall cause, and understand the time frame. It is going to take more than 3 months to treat the hair fall. That's it.
Okay,
Yeah,
so
yeah,
yeah.
I agree with Pooja. Just apart from the causes, what she has mentioned, like hypothyroidism or thyroid disorders, iron deficiency anemia is also a very
Hmm.
important cause of hair loss in
Ferritin.
women, and low serum ferritin that needs to be connected. Typically, what happens post-COVID or maybe post-typhoid, most of your hair follicles goes in a resting phase, and people patient tend to realize the hair loss usually 2 to 3 months after the illness. And typically, if you supplement them with proper nutrition, a lot of exercise, good hydration, it automatically tend to remit in another 3 to 6 months time. And in my opinion, in experience, 70 to 80% of the patient will spontaneously get hair regrowth, and they don't require any procedures. Most of the time, the patient do come to us and they say, "Ki, get my PRP done, or I want to do the micro needling." Has my some of my other colleagues has also done it. So we also always tend to advise them that we will go little slow. We will
Exactly.
wait for the spontaneous or a natural regrowth of the hair. If it doesn't actually this doesn't work, then maybe we will go for some procedures. So apart from this pattern of hair loss, what is more common form of hair loss in males is androgenetic alopecia, what we call it as. We call it as male pattern baldness. Typically there is a recession of your frontal hairline and thinning of the hair from the vortex. So that's a different kind of a hair loss, for which usually the males goes to dermatologists for the treatment of the same. Treatment of this male pattern hair loss is entirely different than what is discussed by Puja, where we need to use medications like minoxidil and certain other preparations, and patient may require procedures also, and maybe if the hair loss is very severe, they might require hair transplantation also. So hormonal hair loss or so-called male pattern baldness in men is completely has a complete different etiology or a basis, and they need to be tackled in a very different manner.
Okay, so what do
Yes.
you have to say about this, hair bonding, hair weaving, hair patches, hair transplantation?
Hair bonding, weaving, all these are the camouflage procedures. They are temporary or like a wig or an add-on hair-like procedures. That is not actually the part of the actually dermatological treatment, but no doubt
Okay.
they are effective. And in patients who has a very severe loss, in whom we cannot do hair transplantations, or they are not responding to your medical line of management or surgical line of management, they can go for this palliative hair restoration techniques, like hair weaving and bonding. Usually not done by dermatologists, but done by the trained or the skilled people.
Okay. Okay. Now, again, as we are talking so much about, beautification things, I think that a lot of people nowadays are coming for mold removals as well. So, what are moles, and do they actually need to be removed, or or is it like advised to remove them?
Yeah, actually, that's a very, very valid questions. Moles, I have seen. Actually, I worked in Germany also, where even they are too much worried about the moles. The moment they will see a mole on your skin, they will immediately go to a dermatologist to take it off, because there is always a fear of melanoma in those moles. But as far as our Indian skin is concerned, there is nothing to be feared about. Moles are very natural, very benign or a banal conditions, and they will not produce any harm. Neither will they will turn into cancer. A lot of people do come to us and they are worried about. They read it on the net or in the internet that moles will cause cancer. But moles are very benign conditions, and
I
Okay,
can't
I
hear you.
think Dr. Pandey's network has frozen. So, Dr. Puja can continue for
that
now.
answer, and our answer to them
Okay,
is
no, he has come back.
Hmm.
Okay.
I think there's a network glitch
Yeah,
which
yeah.
we're.
So, Dr. Puja, you can just
Yeah.
continue with
yeah,
his.
So more,
yeah.
I think he's back. He's back. So you want to add
Yeah,
on?
so moles doesn't
Yep,
need to be
yep.
worried about, should not be a matter of discussion also, and there is no need to visit to a dermatologist for mole treatment. Only if it looks very bad or if people want to remove it by choice.
It's just a aesthetic concerns would be, and it's
Yeah,
not
yeah.
a condition, skin disease or something. It's your choice. If you want to get removed, of course, we have lasers and we have advanced lasers to remove moles. But that is a good part to have moles. It is a protective phenomena, maybe UVA ka protection and everything. And over a period of time, everybody will get moles and DPNs or tags. But there is some misconception, Surbhi and Dr. Pandey, with moles and skin tags.
Yeah,
Skin
yeah.
tags they look like moles, like they are pedunculated little bit. So if you see skin tags lot on your around your neck area or your around the face or underarms, that is a sign of a telltale sign of raised cholesterol and insulin resistance. So that is a early sign that, as I already mentioned you, like we dermats are CID agents. So we can tell you that there is something wrong with your insulin resistance, and that is the reason why we are getting skin tags, right? And our skin has insulin like growth factors. So if there is insulin resistance, so insulin levels are increased, which will indirectly increase the insulin like growth factors which are present on the skin, and that leads to thickening of the skin at particular area. That is the result why we get tags and pigmentation around your neck and DPNs and skin tags. Okay, so the moles are different and skin tags are different, but in general, patients think only one term they apply is moles, right?
Right.
And there are treatment options available, and it is according to the patient's choice. Like we will never say come and remove the mole, but it is always a patient's choice. And there are advanced lasers now available, and they can be completely removed. But if you have skin tags, and if your lifestyle is not proper, your insulin resistance or you're pre-diabetic, even if you remove those things like tags, they are going to reappear. If your cholesterol is not controlled, right, these things are going to
Okay.
reappear. So this I would like to highlight that these are the warning sign, either you're diabetic or your cholesterol level is high.
Okay. So nowadays we talk about a lot of laser therapies in dermatology. So what are these laser therapies and for what all are they used?
Okay, so do you want to take it?
No, no, you can go ahead. No problem.
Okay, so the lasers. I mean, okay. So the lasers are there are different type of lasers. It's a one broad spectrum, right? The lasers can be for your hair reduction. The lasers can be for your pigment reduction. So it is a general one cap you are using to describe lasers. So a lot of good lasers, like for hair reduction, we have diode, which is very useful in removing unwanted hair. But people need to know that it is a reduction, it is not a removal, it is not a complete treatment, like do one session of laser and your hairs will be completely vanished. No, the thickness and the frequency of hair growth will reduce over a period of time, and it is reduction, not a removal. And the you have to go to a dermatologist. We need to know the cause why, like if the girls generally in teens or in their early 20s, they are getting a lot of facial hairs in a male pattern of distribution, like hypertrichosis, like they'll get mustache, and they want to or the side locks are getting hairy, thick curly hairs, the side locks and all. So in that condition, one of the leading causes polycystic ovarian disease, as already discussed. So we need to treat the underlying hormonal imbalances. Along with that, the lasers can help, which is a diode 808 frequency, which targets the hair follicle. You need to understand the gap between the two sessions, and you have to have a real estimate. Like it is not going to be like you do two sessions and your hairs will be completely gone. No. And the gap between the two sessions of hair removal has to be at least 6 weeks. So there are certain quacks, and they will promise you that do every 15 days and your hair will be completely gone. No, it is no, no, no. The hairs will not be completely vanished, it will be reduced. And you have to understand the time frame when you are going for hair reduction. So this is the first laser. The second booming laser is for pigmentation. Q switch laser. So the Q switch lasers can be used for a lot of indications like tattoo removals. Tattoos can be completely removed with the help of Q switch laser, which is but it is not a single session. It might take 4 to 5 depending upon the color, pigment, who has done the tattoo, whether it is done by amateur or it is done by a roadside person. So other things have to be taken considered. Even the pigmentation, uneven skin tone can be completely removed by Q switch lasers. And there are a lot of lasers for even acne scar treatments. But first, you need to treat your acne. You can't go for the laser. So I have patients who will come directly who will have active acne and they'll say, "Is there a laser for acne treatment?" So you can't directly jump for laser treatments for acne. You have to understand. You have to treat your acne first. You have to treat your active acne. Then you go for your spot treatments. Then you go for scar treatments. That is with the help of your lasers. Anything
Yeah.
Pandey sir would like to add on?
Yeah, actually, lasers are really a wonderful devices. They are very, very specific, and people have a misconception that laser is like a beam that will actually
Yes,
penetrate through your skin and will cause a lot of damage.
skin
So that is not the
cancers.
case. That is not the case, and that is the reason many people try to avoid the lasers, such as hair removal lasers or lasers for pigmentation. But believe me, they are absolutely safe in the hands of dermatologists. That needs to be mentioned, and if work properly and with judiciously, they can actually work wonders with your skin. There are different lasers for different dermatology indications, and the most popular amongst them is hair removing diode laser and NDR laser for tattoo removal and for the pigmentation. We have again a carbon dioxide laser called CO2 laser for the
Fraction
treatment of
CO2.
acne scar, as Pooja has mentioned. So there are different lasers for different indication. But to actually go to a very proper qualified and a trained laser or a dermatologist, laser surgeon or a dermatologist, and always follow the protocol. There are a lot of do's and don'ts with the lasers, and we need to follow the advice or we need to follow the protocol as been outlined by a dermatologist. But no doubt they have really worked wonders, and they are a very marvelous devices, but that needs to be used with caution and diligence.
Judicious use.
Yeah.
Yes.
Okay, so Dr. Pooja, are good quality advanced lasers at affordable rates available in the city of Nagpur?
Yeah, they are. Of course, they have. And most of us dermatologists, we have advanced lasers and they are affordable. People need to understand that a good laser is going to be really helpful in treating their skin condition in a better way because uh, the good quality of lasers definitely add impact to your treatment protocols, and it reduces, if you use a good laser, the treatment time reduces because the lasers are effective. So if you go for like a like different type of lasers, even the salons are having lasers. I was surprised. Yes, salons do have lasers and they are operated by salon owners. Unfortunately, in India, we don't have any protocol, or there is no strict licensing, or there is no a strict vigilance. So that is the reason why we get a lot of burns due to lasers. And then people have misconcept like lasers, if you use, they'll cause burns or cancers. I get a lot of patients and their mothers will be saying, if I tell treatment, like, she'll need laser treatment for her uneven pigmentation, the first thing is that comes to their mind is lasers are going to cause cancer, or the rays are harmful. So you need to understand they are very safe, very effective if you use it judiciously and by a proper certified dermatologist. And there are affordable lasers, of course, affordable treatments available in Nagpur.
Yeah,
I can
everything
guarantee.
depends what is the definition of affordability. But one needs to understand that the rates or the expenses for the laser is directly related to the quality of the lasers. Most of
Exactly.
our patients land up with some unqualified persons or quack who offers laser as very, very reasonable or a very cheaper rate. but actually those may not be a good quality lasers, and that will actually cause harm to your skin rather than the benefit. And these are the people will actually bring very bad name to the lasers. Then the people start complaining that I've done lasers but it's of no use. So it is not actually the lasers that needs to be blamed, but again the training, the quality of skills that a dermatologist has, and the quality of machine that actually dictates how laser would be useful to your skin.
Right, right, right. Are methods like cauterization and cryosurgery safe for the skin? And how to pick a clinic who offer these services?
Yeah, cauterization and cryosurgeries are very routinely done procedures by the dermatologist, and the cauterization with will be available with most of qualified dermatologists. And I think we do a lot of these cryosurgical procedures also, but the indications of this cauterization and the cryotherapies are predefined, and actually a dermatologist uses this procedure quite frequently to the benefit of our patient.
Okay, so I think that answers that.
Yeah.
As it was World Cancer Day, I think we should briefly touch upon skin cancers before we finish. So, what are the alarming changes that a person should be able to notice on their skin? How to approach a dermatologist with them, and then how to prevent them, and then how to treat them.
Okay, the skin cancers, by and large, we have two important types of skin cancer, what we call in dermatology as one basal cell carcinoma and a squamous cell carcinoma. And these skin cancers are more common in an elderly individual. So as we grow older, the chances of these malignancies are very higher. Most of the time, if somebody has an ulcer on the face that is not healing after a long period of time, or if somebody has having a fungating cauliflower like growth on the face or on any other body parts that is getting infected and that is producing a very foul smelling, that is getting ulcerated, so that is the alarming sign that we need to visit a dermatologist for proper diagnosis and treatment. As far as the most feared cancer in the Western country is concerned, that is melanoma. Fortunately, it's very, very less common in country like ours, as I already mentioned. But if you have some moles that is showing change in the color or change in the growth pattern, if it is growing too much in size, and a lot of color changes are there. So we have what is called as ABCD criteria. So when you go to a dermatologist, he will apply this criteria, and we tend to pick up melanoma at early stages, but it's very, very less common in occurrence in country like ours. What is more common in our country is basal cell carcinoma and squamous cell
Squamous.
cancer, but it typically occurs in the older age. Fortunately, it is not so common in the younger population.
Okay, Dr. Pooja, would you like to add something?
He has covered all the points, but there's a general is a twofold or threefold increase in size of the lesion on the face within a span of 6 months, and if there is a bleeding from that site, or fungating mass or smell, and yeah, these are the some warning signs. You should go to a dermatologist. A skin biopsy is one of the first way of diagnosing the skin cancer and taking the right treatment from the dermatologist, and it is completely treatable, and there are a lot of treatment options. But we don't have a lot of skin cancer patients, luckily, in India. Melanoma is very less, very, very less, and it is always seen in older age groups, mostly in farmers, because they are exposed to a lot of sunlight. Squamous or basal cell carcinoma, that too we have very few in frequency skin cancers in India. That is a good thing.
Yeah.
Right. So before leaving, I think we did already cover the lifestyle modification advices. But what would be your take-home message for our audience regarding skincare routines that they should follow? Also, there is
Yes.
another question, but
Yeah.
I think we'll first finish with this.
No, I think proper hydration, then doing a lot of exercises, having low carbohydrate and low fatty diet, avoidance of junk food, use of regular fruits and vegetable in your diet. So it's nothing different from your general health, but more importantly, you need to keep your weight under control. Particularly applies to the adolescent girls. So if they, I always tell them that if they keep their weight under control, so obviously their hormones will get balanced, and they will actually prevent a lot of skin diseases like pimples or hair loss or skin tags or skin darkening. So many of issues can be simply sorted out by weight reduction. But saying it is easier, but our younger generation need to we need to emphasize a lot on their minds regarding lifestyle modifications. So I think this is what the skincare in routine is about.
All right, all right. What basic skincare precautions would you advise to people that are troubled by growing wrinkles on their face?
Okay, can I take it?
Yeah, yeah, please,
Yeah,
please.
So,
if you see
first
this,
thing
if
is,
you see this, visit Dr. Puja. That's the simple precaution.
no, no. First thing is, love the skin you are in. Wrinkles are going to happen, and it is part of aging. And you have to have wrinkles. That is a natural process. You can't arrest aging, but you can age gracefully and beautifully with the help of board-certified dermatologist. There are certain ways you can prevent wrinkles. First, you need to prevent wrinkles rather than going for Botox. First thing is, you need to use a good amount of moisturizer, good amount of sunscreen. I have a three rule of 3S. So avoid smoking. First S. Use a good broad spectrum sunscreen, which I've already mentioned. And the third S is avoid sugars in your diet. So that these are the three S's which will help you prevent having wrinkles. And when you get wrinkles, we have advanced treatments like Botox, and which can like the treatment we inject a botulinum toxin, which is very safe. It is not going to cause any harm, or it is not going to cause poison, or it is not going to burn your face, which is very safe when it is done by us, dermatologists. And the Botox treatment, it is not a complete one time treatment. It has to be retouched after 7 to 8 months. So I tell my patients, I do Botox treatments for fine lines and wrinklings, and the treatment of my patients come for touch up after like 8 to 9 months. So now that is also if you want to go for wrinkling treatment, but aging gracefully with wrinkles is equally good. And lastly, if you keep your stress at bay and take care of your health, your skin is going to be really good. So
Yeah,
have
that's
a
the
basic,
yeah.
yeah, you need to take your stress at bay. You need to
Yeah,
have
that's the fourth
a
S.
balanced
That's the
life
fourth S
approach.
puja you can add. Fourth S,
Yes, stress at bay.
sugar,
Yeah,
smoking, and
food.
avoid stress. Be happy.
Yes.
And as you rightly mentioned in the beginning, skin is the
Love,
mirror of
love
your
this.
internal
Yeah,
health. So if you are
and
happy,
love the
if you are
skin.
stress free, if you have no sadness, you have all reasons to glow.
And don't use too many products and too many regimens. Use basic three-step regimen. You wash your face properly, use a good moisturizer, and use a good sunscreen in the morning. At night, wash your face properly, use a good moisturizer, and night cream after, as prescribed by a dermat. Don't. There are different types of night creams, like retinol-containing night creams, which should be applied after 25 or 30, which will be prescribed by your dermat. And keep a very simple regimen. Don't use lot of products, lot of cosmetic. Keep it simple, keep it easy, and keep it approachable, and keep it very easy use. It should be. It should not. You shouldn't run for a marathon for skincare. You should have small, small goals to keep your skin good and healthy. That's it.
Correct, correct. So I think we have reached the end of our show and we have already overshot our time, but it was a wonderful session. And I think we covered almost everything, like everything basic related to skincare. And I think through this show and today's session, a lot of people will understand their basic skincare routines and also when and where to approach dermatologists, what to do and what not to do, basically. Okay, so thank you so much, Dr. Pandey and Dr. Puja, for accepting our invitation and coming on the show and speaking out publicly about, skincare and what dermatology actually is about and how important that science is. So thank you again, and wish. Okay, you can give your closing comments, please.
Oh, pleasure to have you. Pleasure to have such a healthy discussion along with you, Surbi. Thanks a lot. I hope people will find it interesting and there is something that they will follow in their daily routine.
Yes, yes.
I like the theme
Okay.
of S actually, stress, and I'm adding one smile. Always smile. I'm going to
Yeah.
add more
So
S to it. Yeah.
yeah, we can keep
Good,
on
good.
adding. Okay. Okay. So thank you so much. Thank you for our audience for tonight. And this will be uploaded on YouTube and Facebook permanently. You can always revisit this for more information. Also, like, comment, and subscribe. And you can even comment as to what next you would like us to cover on the show. So, thank you for following Evrox Healthcare. Good night. Have a very wonderful winter.
Weekend. Thank you.
Yeah,
Thank
weekend.
you, thank you, thank you for the nice session,
Bye
Dr.
bye.
Survi. Thank you, Dr. Sushil sir. Thank you.